One of the physicians leading the pandemic response for the Saskatchewan Health Authority is Dr. John Fro. He's also an emergency room doctor and STARS transport physician. Dr. Fro's work during the pandemic has earned him this year's Distinguished Service Award from the College of Physicians and Surgeons. Welcome, Dr. Fro, and congratulations on your award.
Thank you. Thanks for having me.
So you're a man of many hats, many hats. Of all the jobs you've done, especially over the last couple of years, what are you most proud of?
I think our response here at the EOC for the Saskatchewan Health Authority has been a real highlight of my career in terms of the management of the pandemic and just readying our health system and preparing it for the people of this province. I think, during such a tumultuous time and such a challenging time, I think that's one of the highlights, I would say.
Those were the highlights, and you said tumultuous. There have been many hard decisions that you've had to make this year. What is the hardest thing that you've had to do this year?
Well, I think this year, when we were, in a position where we needed to transport some of our most critically ill patients out of the province due to, overwhelming numbers in our critical care spaces, that was a very hard and challenging decision to make. And I can say that our, the teams that we put in place to do that did an amazing job in a very tough circumstance.
And the tough circumstance was this recent wave that put a huge strain on the healthcare system. What toll has it taken, and is it going to continue to be a little bit a stress on the system?
So I think, our health system has been stressed in a way that I don't think it has ever been stressed before. Our frontline clinical healthcare workers they're tired. I think they're beaten up after this wave, and we're not out of it yet. There's still a lot of pressures, and of course, with new variants emerging, there's a lot of questions, a lot of anxiety, and there's a need to continue doing the things that we know work to mitigate the spread of all COVID variants. So non-pharmacological interventions such as like masking, distancing, all those things that we've been doing for so long and have become second nature. It's going to be important for us to continue doing those things.
Are there going to be some lessons that we learn from this that we can use not just for hopefully not upcoming pandemics, but for other issues in the future?
Yeah, absolutely. So, when a system, whether it's a health system or any other system, goes through a period of crisis, it's like in cardiology when we do a stress test. We put a patient on a treadmill and we see if they get chest pain and we see if they have, ECG changes. Well, our health system just underwent like an extreme stress test, and so we've seen areas that need attention. We've seen areas that, where there are places where we need to improve. And I think that the SHA has been an organization that's dedicated to continuous improvement. And I think that the lessons learned here have been hard lessons learned. And I think they will inform future action in both within pandemic and also post-pandemic, because this pandemic will end and there is another side to this.
So do you feel that with all of these accomplishments that we're on the right path now?
Yeah, I think so. It's one thing that I've learned in the pandemic is that where you are right now is not necessarily where you'll be in 15 days or 14 days. And so I think that collectively, we need to do the things that we know work. We need to, get those vaccines into arms. We need to continue, using things like proof of vaccination to encourage people to do that. And ultimately that will be our way forward through and to the other side of this pandemic.
Thank you again for your time. Congratulations, and thank you for all your work.
Thank you.
Dr. Fro is the Deputy Chief Medical Officer with the Saskatchewan Health Authority.